Hello everyone, welcome to sqadia.com, and now in our final section of the lecture topic benign conditions of the ovary and pelvis, we will go over chronic pelvic pain. So when we will talk about chronic pelvic pain, we will talk about how much is the incidence and what are the different causes of pelvic pain, how we diagnose and investigate it, and how we manage pelvic pain. Chronic pelvic pain. So first thing we should know here is what is chronic pelvic pain and what's the difference between acute and chronic. Very important terms used in the medicine, acute and chronic. Acute is of short duration, short-term pain. Chronic is long duration, that's there for longer period of time, that's chronic pelvic pain. So chronic is at least for 6 month duration. When it's present for 6 months, then we label it as chronic pelvic pain or chronic pain. If it's less than 6 months, it's labeled as acute pain. It's very debilitating condition. Lot of females come to the gynecological office, and gynae visit is usually because of the pelvic pain or lower abdominal pain. What's the incidence and what are the different causes of chronic pelvic pain? Incident is about 20% of all outpatient appointments. Usually they come and complain about the pelvic pain. Prevalence is 10 to 20%. What are the different causes of pelvic pain? If it's gynecological causes are usually endometriosis and adenomyosis. Endometriosis, when endometrium is present outside the uterine cavity, it's a very common cause of pelvic pain or lower abdominal pain. And adenomyosis, or in this there is infiltration or invasion into the muscle layer of the uterus. So adenomyosis also present with the pelvic pain. Then adhesions that are formed after pelvic inflammatory disease, PID, pelvic inflammatory disease. Any inflammation or infections in the pelvis leads to adhesion formation or scar formations that can lead to pelvic pains. Then if there are fibroids or cysts present, that also leads to pelvic pain. So these are some gynecological causes of chronic pelvic pain. So what are the causes of nervous system causes of pelvic pain? These can be changes in both afferent and efferent nerve pathway. So if there are changes in afferent are the nerves are the nerves that bring the information to the nervous system, afferent to the nervous system. Efferent are the nerves that carries information away from the nervous system. So if there is any changes in these pathways, they can cause pain in the pelvis. Then just gastrointestinal causes of pelvic pain. Again, very common causes are irritable bowel syndrome, constipation, and celiac disease. These leads to pelvic pain. Urological problems, bladder pain, syndrome, and then UTI, urinary tract infections, can cause lower abdominal pain, dysuria, frequent urination. So all these are also present along with the pelvic pain. Then some musculoskeletal reasons of pain is pain arising from the joints in the pelvis. So these also can lead to radiation of the pain from the pelvic bone or hip bone can lead to lower abdominal pain. So not only gynecological causes can lead to pelvic pain, there are other also, among them urological problems are very common because UTIs are very common in females, urinary tract infection, that can lead to lower abdominal pain. Now, some diagnosis and investigations done for chronic pelvic pain. History is important. In history, ask the patient what type of pain they have, whether it's a constant pain, whether it's occur in episodes, it's dull, it's radiating, it's colicky. So these are very important questions that can lead to the diagnosis, if what type of pain they have. Or is the pain associated with any other problems? Is there any incontinence of urine? Is there any nausea, vomiting with the pain? So all these questions are important questions. Then some investigations, what are the indications for them and what's the potential diagnosis. So genital tract swabs. So swabs got from the cervix, vagina are all very important. They detect, the indications are sexually transmitted infections like chlamydia and gonorrhea can lead to lower abdominal pain. So genital tract swab is important. Diagnosis, usually they lead to infection and pelvic inflammatory disease. Then pelvic ultrasound, usually done to find out any pelvic masses, and diagnosis, it can be adnexal masses, cysts, fibroids, all these are differential diagnosis. MRI is done for assessment of, again, further masses, but MRI is specially done to find out how deep is the invasion or how deep is the lesion infiltrated or growth infiltrated. So that's done by MRI, usually done to find out any rectovaginal endometriosis or any masses seen on ultrasound. Then laparoscopy is done to find out pelvic masses, any adhesions or endometriosis, and then the diagnosis can be endometriosis, adhesions, or pelvic masses. So four main tests: genital swabs, ultrasounds, MRI, and laparoscopy. And indications, mainly swabs are for sexually transmitted infections, and all the others are for the pelvic masses. The management of pelvic pain is healthy diet is important. Hydration, excess fluid is important, exercise, sexual health is important, hygiene is important, analgesia, if there is unbearable pain, then usually non-steroid anti-inflammatory drugs, opioids, paracetamol are used. Hormonal treatment is also sometimes very, very effective. Oral contraceptive pills, combined oral contraceptives can help in relieving the pelvic pain. Surgical treatment, if there are any masses, if there are any adhesions, then surgical treatment is usually recommended. So that was all about the chronic pelvic pain, in which we talk about the incidence, etiology, diagnosis, and management. So thank you for watching sqadia.com.